So we're so pleased to have you all here today. I'd like to introduce myself. I'm Liz Forer. I'm the Chief Executive Officer and Executive Director at Venice Family Clinic. I want to thank you for joining our Health and Justice series. We created this forum to discuss all the ways that health intersects with our society and why it's critical that we understand the injustice that stands in the way of everyone having access to health care. Before we start, I want to mention that there's a Q&A function at the bottom of your Zoom window. Questions regarding our presentation will be answered live as we move through the show, so please ask questions as we go in the chat room. Now, allow me to introduce Susan and Gayle. I'm pleased to be joined by these two extremely dynamic women in a conversation about the link between health, trauma, and incarceration. Susan Burton is the founder and president of a New Way of Life Reentry Project. She started a New Way of Life in 1998, dedicating her life to helping women break the cycle of incarceration. Susan will tell us more about her story today, and we are proud to call her a friend of Venice Family Clinic. Venice Family Clinic provides primary health care to people in need, and we're very comprehensive. We do our care in an integrated way that brings together medical care, mental health, substance use treatment, dental care, and many other services. This year, we are proud to name Susan as one of Venice Family Clinic's 50 visionaries who inspire us and have an impact on the health of the community we serve. Susan and I are both delighted to have Gayle King join us. Gayle needs no introduction because I'm sure you've seen her reporting and hosting at CBS News, and heard her on Gayle King in the House on Sirius XM Radio. Gayle, we're so honored to have you with us today, and it's now my turn to hand things over to you.
All right, Liz, I got it, I caught it, thank you very much. First, thank you for describing Susan and I as extremely dynamic. Susan, I'm gonna let you pick up the mantle with the extremely dynamic part, because I wanna start with you, Susan, if it's okay, because I want the audience to get a sense of you. I've been reading about you. I read your story. I've been reading about the clinic. And I just want to say, I bow down to you. I'm in awe. And I want people to understand, if you wouldn't mind briefly, a little bit about you. You've had a very difficult life. You've talked about sexual abuse, physical abuse. You've lost a child. You started a program, and I think it's so aptly named, called A New Way of Life. So what's your best way to describe what you want people to know about you?
So I'd like people, thank you, Gayle, and I bow to you. I've watched you so many mornings, and I have to catch you on the Sirius channel too, now that I know you're there.
Yes. In the kitchen, here I am, yes.
Yeah, I'd like people to know the struggle and the challenge of women, my struggles and my challenge, also my ability to overcome. So just to give you an idea of what I've been through in my lifetime, from an early age, there was just so much trauma and abuse. And I learned to hold on. At the age of 14, I was raped, and through that rape, I conceived a daughter. And I can remember my 15th birthday and my mother asking me, what do you want for your birthday? And I said, Mama, can I just please keep my baby? And she said, yes. And that's—
Wait, back up, Susan. You wanted to keep the baby even though the baby was conceived of rape.
Yeah, even though the baby was conceived of rape, I wanted my baby. Everyone else was adopting their baby out. I wanted to bring my baby home. And my mother told me, yes, I could have my baby. And that's just like that's a 15th birthday present, but life was just really, really difficult. And again, I learned to hold on. And you can imagine a 15-year-old with a newborn baby. It was hard.
Yeah, but that says something about you, Susan. That says something about you, that at 15, even though your daughter was conceived of rape, how old is she today, and how is she doing today?
She's really, really doing good. She is 50, she'll be 55. And she's doing well. She's a manager at a corporation in HR. I have a granddaughter. She's watching me from her hospital bed right now. My daughter's name is Tony.
Hi,
She's
Tony. Hi, Tony. I hope you're going to be okay. We're thinking about you. So
Yes.
Tony is born. You carry on with your life.
Yes.
You had some run-ins with the law.
Yes. Yes. I had some, minor run-ins with the law.
What does minor mean, Susan?
Minor means I was trafficked.
Mm-hmm.
Yeah, that means, it means I was trafficked. It was just hard.
Mm-hmm.
So 10 years later, I have a son. His name was Marquet. We called him KK. He was a rambunctious little boy. And he was killed by an LAPD detective. And at that point, I could no longer hold on.
Killed? What do you mean killed by an LAPD detective?
He was ran over. A detective ran him over in his car. And he never got out of his car. And the rage and the pain and the loss just sent me into such depths of darkness, depression, and despair. I began to drink, and I drank alcoholically. I drank to drown the grief, and it escalated to drug use. And for drug use, I was imprisoned. And I asked for help, and I never received help. I was in prison not one time, but a half a dozen times, and no one ever seemed to help me until I reached Venice Family Clinic.
Yeah.
And there,
that turned out to be, it sounds like a game changer for you. We should say that I'm assuming it was an accident that the police detective hit your son. Still, that's no excuse for not stopping, but that sent you into a spin and a turmoil.
yes.
And so for most people, that would take them to a very dark place. You go to Venice Family Clinic, and what happens that was a game changer for you at that facility?
Well, at Venice Family Clinic, I got all the medical and mental health needs met. I was given a counselor, a therapist, that I was able to sit down with that therapist every week and talk through the pain and trauma of the past, but also the hope for the future. And I began to get on a healing journey.
Yes. Yes.
And
let me bring Liz in here. I think that's
okay.
a perfect place for you to enter into the conversation, Liz, because I like what she said. It was a game changer. It sent her on a healing journey. And I think that speaks very highly to the work that you all do at the Venice Family Clinic. You hear stories like Susan's and you think what in relation to what you all do there?
Well, it's very uplifting, and very quickly, Susan, I'm closer to finding the therapist, so you can thank her. So I was in touch with the alumni association yesterday, and we'll find her. Susan's been asking me to find the therapist that helped her, to thank her, who was a superb intern with us that year.
Oh wow!
But,
I could see why you'd want to connect with them. Yeah.
So what I think of is how far we've come as a clinic, and how far we've even come since Susan came to see us. So we learn from our clients here, and we learn what works best. And one thing we noticed was we started our mental health program in around 1992, 1993. And it was this monumental decision that our board made. But the result was that we were already early adapters of integrating it into care. So that when Susan saw her primary care physician, we immediately had some screenings that we were doing that told us she needed to see a behavioral health therapist, our mental health therapist, and that she could get the kind of care she needed in a setting that was friendly. And by that, we really work hard to make the places that we have inviting and comfortable for people, and the counseling rooms feel homey and nice, and to make sure that people feel heard and that they can trust us from the minute they come in. And what struck me is Susan, when she shared with me her story about coming to the clinic, I felt so happy that she she received what we've been trying to do. It's, you know, we see a lot of people and you want to make sure that each one has a good experience. And so that is very touching to us. She also is proof that it worked.
Yeah.
And as well as being proof that it works, she's gone out into the world and helped other people change their lives. And it's extraordinary. So I think I feel grateful to hear that what we've been able to do is hundreds of people working together with community volunteers and interns and our incredible staff, that what we have tried to do since our beginning in 1970, which is to help people get quality care, is working and is changing lives. So that's important.
Clearly, Susan, and we should say to the audience that's listening, we are taking your questions. We'll take them either at the end of this conversation or while we're talking, but we encourage you all to join in the conversation too. Susan, something struck me that Liz just said, is that it was a friendly place, it was a beautiful place, and the surroundings make a difference. When you started New Way of Life, one of the things that stood out to you is you wanted a place where people felt safe, whether it was the colors, whether it was the way it was laid out. You worked with Frank Gehry, a very well-known architect who calls you a friend, go you, calls you a friend, that all of those things mattered when people come and they need help.
Yes, it does matter. I wanted a place that was motivational, that was bright and cheery, that that women could come to and feel safe and comfortable and hopeful, as I was hopeful about the future. And I didn't realize the impact of that type of environment has on your mental health.
Yeah.
But Liz is so right. It was cheery, it was comfortable, it was colorful, and there was light streaming in from everywhere. And I felt safe.
You know what, also, Liz, that's very important, but I think, Liz, people don't understand the connection between trauma and health. I don't think people understand that there's a huge connection between the two, and how that can deeply affect your life and your mental health too, your mental and your physical health. Could you talk about that a little bit and what you all do at the Venice Family Clinic to help that, to address that better?
So quite a few years ago, we learned from Dr. Nadine Burke-Harris, who is now the Surgeon General in California, about something called adverse childhood experiences. And we sought then to train all of our staff and everyone here at the clinic in what's called trauma-informed care. And why did we take this huge step to do all this training and to move ahead in this way? Because trauma has adverse effects on health. It leads to long-term changes in the structure and function of children's brains and bodies, and can impact educational attainment, leads to risk of violence in people or incarceration. It also affects basic health, heart disease, stroke, cancer, Alzheimer's. Anyone that experienced lots of trauma can often be at risk of all these health problems. And so we really wanted to start early and focus in. And so we first tested what's called the Adverse Childhood Experiences questionnaire on all of our prenatal patients. And we found, because we said they're going to start out with having a baby and starting a new family. And if we can work with them early and they can be in touch with what their trauma is, and oftentimes people who have experienced a lot of trauma, they view them as singular incidents, or you kind of push it away and don't even recognize that it's there. You could put up a big wall to it, and just acknowledging it.
You can compartmentalize it, can't you? Yeah.
Yes. Just acknowledging it is so important, because oftentimes the person will say, oh, I see this. And even just knowing that helps them to then move differently and get help they need from us and others. And so that's really important. So many people that are joining us today, when we talk about adverse childhood experiences, it's a simple questionnaire we give out of 10 questions, and we ask the person simply to say, how many of these have you experienced? We don't say which ones, we just say, how many have you experienced? And so it's a range of, were your parents or guardians separated or divorced? Did you live in a household where someone was depressed or mentally ill or attempted suicide? Did you live in a place in which people threatened or hurt each other? Where people were using substances or had alcohol problems? Where maybe there wasn't enough food or clothing, or there was no one there to protect you or vouch for you or help you as a child? And
you know what's interesting about those questions, Liz, is that some people will just listen to them and think, well, that's my life. They don't think of it as traumatic, you know?
Right.
Exactly.
A divorce, were you abused? They don't think that this is having an effect on them. And Susan, I look at your story, you know, sex trafficked, raped, drug problems, alcohol problems, the death of a child in a very terrible way. Were there times that you thought, I just don't want to be here, I can't make it, I can't handle this?
There were times when I thought, you know, what's going on? Because, you know, I felt, and this would be my conversations with God, pretty much. I knew there was more. I knew there was more to me than what I was experiencing.
Yeah.
But I didn't know how to bring it up and bring it out. And the questions that Liz was just asking, yes, they were the norm. It was life.
Yeah.
I don't think there's, you know, anything else. And I didn't until I sat down in Venice Family Clinic. I didn't until I got into the community of Santa Monica and I saw how different life could be. And I was like, wow, this is like two worlds.
So you took, Susan, what happened to you and said, I'm going to help others.
Yes.
And so what is it because I read that you saw the inequities. You called it a tale of two cities.
Yes.
Like if it happened in Santa Monica, women there were offered therapy. If it happened to you and people like yourself, they're sent to jail.
Yes.
So what is it that you saw that you realized I could help others?
I saw that with support, with kindness.
Kindness, yeah.
Kindness, yes. With love, with resources, there could be a whole different trajectory for people. Gayle, I sat there one day and I thought I couldn't turn back. All of the years of pain and suffering that I had went through, but I could stop another woman if I was able to extend her support. I couldn't bring KK back, but I could help another woman to get her child back. So I've had the opportunity to stop over 1,000 women's journey to pain and suffering. And I've got to play with over 300 children who have been reunited as a result of our support. And when I walk into the house, Gayle, and the kids, they just like, that's Grandma Susan. You know, they don't say that.
Yeah, Miss
But
Susan.
they run to me, they hug my leg, they know that I'm the support for the security they always wanted with their moms. So it's beautiful.
Nothing better than a child hugging you on your legs. Nothing. I mean, you said, I look forward to the day, knock on wood. I have a favorite daughter, Kirby, who's 34, lives in LA, and a favorite son, Will, also lives in LA. Kirby's engaged, and I look forward to the day that I have a grandchild. What does your granddaughter call you?
Grandma.
I don't want to be called Grandma Susan. I don't want to be called Grandma or Nana or Grandma. I'm trying to think of a cute name, but I digress. I like what she said, Liz, about kindness, offering kindness. It's such a small thing, but it's such a big thing. And I'm wondering in this time of COVID that we're all living with it. You know, I saw an interview with TD Jakes. He was talking to Oprah and he said, you know, we've all been put in a universal timeout. That's how I feel. I feel like we're all in a universal timeout, and kindness sometimes is in short supply, and it's so important. But I wonder what COVID has exposed, or has it exposed anything to you and what you do at this particular time?
I mean, I think the hard part is the people we serve. COVID has caused many things. So for them, COVID has caused them to lose jobs and not be able to go to work, or if they're essential workers, working really hard jobs and then possibly bringing home illness and everybody getting sick. Many of our patients live in very close quarters. And so when one person's ill, it's hard to isolate from others. It's also exacerbated food security. Our food program that we started a wonderful free market in February. So we started off every other Tuesday, 300 people would come. When COVID hit, it became 600. Then 2 weeks later, 900. Then we went to every week. Now it's more than 1,000. Thank goodness for Food Forward and the West LA Food Bank for partnering with us. But this is going to keep escalating, and the stress it causes for our patients is huge. You have the stress and worry and fear of becoming ill. You have the stress and worry of trying to make sure there's food on the table, that you can make the rent.
Yeah.
And then on top of all of that, there doesn't seem to be an end in sight. And so there's a sense of, how long will this last? What do we do? How do we make this work? And in some ways, like, all of our staff are going through something similar, but they have jobs with good benefits. And so that's the stable part. And they recognize the importance of trying to offer stability and hope to our patients and ways of coping with this.
I think that's what makes COVID so difficult, guys. You know, whenever there is a catastrophe, and this is a catastrophe, there's a beginning, a middle, and an end. Like when we had Hurricane Katrina, we had 9/11, we knew, okay, we're going to have to clean up, we're going to have to recover, we're going to have to rebuild. I mean, and so we knew that we sort of knew, as difficult as it was, we knew that there was a path out. We could see light at the end of the tunnel, even though it may have been a very long tunnel. This thing is such a moving target and is so ongoing that there are no really easy answers here. And this speaks to a question, and they talk, and we also have 3 crises at the same time. We have a health crisis, which is turned into an economic crisis, which we now have a racial strife and unrest in this country in a way that many of us have not seen, if ever, but certainly not in a very long time. So any one of these 3 things would be devastating. And here's a question from someone. Thank you, Navina, for sending the question. How do race and class make a difference with access to resources? Liz, could you touch on that? And then Susan, if you'd respond too.
Well, I'll address the health part, and I'll let Susan address the rest. So essentially, in this country, if you do not have a fair quantity of money, you are at risk of not being able to access healthcare services. And when you think about it, that's fairly crazy. Why doesn't our country want us to be healthy and well?
Yeah.
Why aren't we all able to access quality places? Why do some of us go to a private hospital that's a not-for-profit but charges a lot of money, and others go to the county facilities, which also have some excellent quality, but it's decided based on insurance? And then what happens to people without insurance? So when something is a commodity that shouldn't be sold, it should be given out of kindness and compassion. It causes us to all have a long way to go in terms of making sure people in our communities that have less income have the same access to quality and standards that people who have plenty of income, and that people who are Black and brown are not discriminated against when they go to a hospital and given lesser quality of care. And that happens every single day.
It does happen every single day. You know, I look at the example of the opioid crisis. When it was a predominantly white problem, it was viewed as, well, these people need help and need rehabilitation. In Black communities, when there is an issue as this, they're considered druggies or addicts, and they're taken to jail. So we've all seen the difference. Susan, can you address the question was, how do race and class make a difference with access to resources?
Yeah, I think that the example that you just gave is an excellent example. When I used drugs to deal with the death and loss and pain of my son, I was criminalized. I
Yeah.
was sent to prison repeatedly. When I asked for help, there was no help for me. When I reached,
Did you ask for help? Did you ask for help?
I did ask the judge, I did ask the court for help.
Mm-hmm.
And what happened is that I was sent to prison. I
Mm-hmm.
was chained, I was cuffed, I was ordered to work. If I
Susan,
did,
what could have most helped you then at that point? What could have most helped you during that time?
something like Venice Family Clinic.
Ah,
uh, 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 I was, I shouldn't have been criminalized. I should have been helped. It was a health problem. It was not a criminal problem. I wasn't a bad person. I was a sick person.
mhm.
But then in Santa Monica, there was this plethora, I call it a buffet of resources. And you could just go and get all of the resources that you needed. At Venice Family Clinic, I got dental care, I got health care, I got mental health care, I got psychological care, just being in the place, just being in the building. So there, and I think sometimes, had I been white, would I have gotten help?
Mhm.
I
Well,
think I would have.
and you think you would have. Yeah, I think a lot of people would agree with you on that. You know, guys, there's a lot of conversation now about defunding the police department and taking some of the resources that are given to the police department and turning them over to mental health services and mental health and mental health professionals. That many of the calls that police make really could be better handled by mental health professionals. What do you think about that, Liz, when you hear about calls for defunding the police department? I think the term scares a lot of people.
I think that the role of our justice system should be to do such a good job at prevention by using social supports and community programs that we have far fewer arrests and far fewer prisons and jails. And that the goal of our system should be to help people find, and I'm using a slogan Susan knows well, a new way of life.
Mm-hmm.
And to do that, it requires a complete recreation in the sense of educational opportunities and job training and health and mental health and addiction and recovery. And people can leave prison if they even needed to be there in the first place. So most of the people in prison shouldn't be there in the first place. And those that are there, when they leave, they should have the skills so that they never have to return.
Mm-hmm.
And Susan has a lot more to say on this. So let me let you go ahead, Susan.
Which is why, Susan, probably why you call it such a great name for what you do, a new way of life. I'm sure that's what your thinking was, looking at your own situation and what you wanted for other people.
Yes, I found a new way of life, and I wanted to be able to help other people, other women find a way up and out, find their new way of life, support them to dream again and work towards their dreams and, live good, healthy, law abiding, and fruitful lives, satisfying lives.
Mm-hmm.
Um, I know that our communities are over policed and under resourced. And
Over policed and under resourced. All right.
oh yeah, over policed and
Yeah.
under resourced.
Mm-hmm.
And that we need a reinvestment, a justice reinvestment to realign with what truly makes our communities safe and healthy. And it's just not you or me or I. We all in America have to have a shared interest in making all communities safe and better. Um, so when they say defund the police, it does scare people, but
Yeah.
we really have to examine what's going to make our communities truly safe and healthy.
Yeah, but I don't know anybody that wants to live in a community where the police department isn't well funded and doesn't have all the resources they need either. And I think when you say that, people think, well, you're going to take something and leave the police less than effective. And that's not what the conversation is here. We need to figure out a way that that you're meeting the needs of both. And
Yes.
I do think in the United States of America, that can be done. I like, Liz, what Susan was saying, that we all need to work on this together. It seems to me that that's sort of the mantra of the Venice Family Clinic too, that we are all in this together with the services that you provide. Nobody can do this by themselves.
No, I call it, I observed when I traveled to Japan a few years ago that they focus on the we. They're so focused on how they all work together.
Mm-hmm.
And we here in America, we focus on the I.
Yeah.
And we all need to focus on the we.
Liz, why do we do that? Why do we do that? You hear all the time, there's no I in team.
I know. And
all the time.
Yeah, the thrill of Venice Family Clinic is that we are one big team and we like to partner. And I think there's this, it's very Pollyanna-ish maybe, but there is goodness in our communities and we need to draw that out and use it each and every day with each other.
Yes.
And that's a very powerful force. And we should not forget that, especially during the times we're in right now.
Yeah,
that each of us can do something each and every day that's an act of kindness or to help someone else. And some people will say, well, what is that? It can be small, it can be large, but you need to pick that something and be very cognizant of it and practice it every day. It's a practice.
Mm-hmm.
And then you move on into the practice of democracy with a bigger D, and we'll get there.
I so like, Liz, that you mentioned the word kindness. There's a show called Jesus and Meryl that's on Showtime. These two guys that are actually very hilarious. They're very raw, but they're hilarious. And at the end of the show, they always ask the guests, what do you want your slogan to be? And when they asked me on, my slogan was kindness always works. So that really, when I hear that, that resonates with me. I'm going to close when we wrap up. I'm going to ask you both, what would your own personal mantra and slogan? I'm going to give you a couple seconds to think about it, but what it should be. But here's another great question, guys. I'm not surprised that the care provided at Venice Family Clinic made a difference because of the integration of care, including mental health, very, very key. Do the prisons make any attempt to provide this kind of care during incarceration? Susan?
During my incarceration, I never got any help. Each time I left prison, I left a little more broken, a little more hopeless than when I, went in there. And, we can do better. We say that, so California, where I live, is California Department of Corrections and Rehabilitation.
Mm-hmm.
So they stuck the R on there about 10 years ago. But
the rehabilitation. Mm-hmm.
The rehabilitation, yeah.
Why do you think, Susan, you kept ending up going back to prison?
I would leave prison, I would get on a bus and I would get off downtown Skid Row. And there were no supports for me to rebuild my life. As I said, I was a little bit worse off. There was no safety.
Yeah.
I didn't have an ID. I didn't have any government papers and I had no safe place to go. Yeah. So
how are you supposed to survive and make it?
You can't.
Yeah.
It's impossible. And then that's why I created a new way of life after, I got on the path to healing. And I can remember back in the early days going down and waiting for my friends to get off the bus and offering them a place to live, a place to come, a place to be safe.
And what prevents you, Susan, what prevents you today from going back to prison? You're clearly a law-abiding citizen, but what was the click or the switch that made you say, I'm not ever going back there?
The kindness, and the help, the resources, and the support that I received helped me. every time I left, Gail, I said I wasn't going back,
Yes, yes. And
but I needed help. I needed support. So when I got that, that was the magic. I'm so grateful. I'm so grateful, Liz, that there was a place like Venice Family Clinic for me to come to and to find myself in my direction. You'll never ever know. And that's why I've been searching for the therapist that I had there. I want her to know what the difference that she made in my life and how that difference allowed me to make a difference in other people's lives.
Boy, Liz.
Yeah, and that's, I mean, that's the power of what we all do together.
Yes.
You know, when you hear what Susan just said about what you do there, Liz, and I would imagine people listening to this are moved the way I was moved just reading about you, Susan. So seeing you in the flesh and hearing your voice and feeling your compassion and your humility and your strength too about what you went through. I would imagine people are thinking, what can I do to make a difference? What can I do to help? You know, and I know sometimes, yes, write checks, but it's so much more than that. But Liz, what could people do who are listening who might want to help you at Venice Family Clinic? And I'd like to know what you're most proud of about the work that you all do at Venice Family Clinic. So it's two questions there for you.
So I'll start with most proud of. I'm blessed to work in a place where my job changes every year, and every year we add something that we're proud of. And this year I'm most proud of the fact that we put up a telehealth program overnight and didn't miss a beat in seeing our patients, and that our behavioral health and substance use treatment, actually, we have greater numbers now because people are more available by phone and video, and they don't no-show. They don't have to travel, so they don't no-show. And then our food program, we couldn't have picked a better time to do this work. And it takes an incredible team every week of staff and volunteers to feed everybody. And it's amazing. And any of you are always welcome to come down and volunteer. We insist on masks and gloves, and you will get your steps in. You'll be to 10,000 steps within 90 minutes. But what I would suggest in terms of helping, many people, especially people on this call, are lucky enough to have been able to shelter in place and be at home and want to help in many ways. And I cannot thank all of you enough for the extraordinary generosity you have shown towards us with your donations. But if you would like to help in a hands-on way, one of the most important things you can do is to look around your community. In Los Angeles County, which there's homeless people on every block living in every community, and begin to do something to accept the people in your community that have lower incomes and support affordable housing in your communities. That has to happen. And then if there's other things you want to do, pick an issue that impacts people living in poverty and stick with it for the long haul. It might be access to affordable healthcare. It might be reinventing our justice system so that people who are Black and Latinx and poor have a future, and not a future in prison, but a real future. And then be part of America, or our democracy, with a capital D, meaning get to that city council member, that county supervisor, that state assembly member, that congressional representative, that senator, and let them know that you demand change. And join with others on the areas you've picked to create legislative and structural change. Because if you're not involved, if we are not all involved, who will be? And we're all in this together. Yeah. And it is a time for us to do this work. Susan and I have been doing work together and work apart, helping people for many decades. And all of you have been helping us do that work. but this is a time that we need your voices and your involvement more than ever before.
Mm-hmm. Susan, here's a question for you. Susan, it says. So that would be you, Ms.
Yeah,
Burton. Now that we hear the outcry about drug use being a public health crisis, why wasn't it a health crisis when you needed help, do you think? I think that's a really good question.
So there was a period in our history where there was all the rhetoric coming out of the White House about being tough on crime and the war on drugs. What the tough on crime meant is we're gonna incarcerate as many people as we can. And those were poor people, Black and brown people. And when they talked about the war on drugs, that was a war on people. That ended up in a race to incarcerate.
That was during the Reagan years, the Bush years?
Yes. And and then came the prison building boom. Gayle, imagine had we invested in a healthcare system as we invested in prisons.
Yeah.
We would be in a real different place right now.
I hear that all the time, Susan. Do you think that people finally believe that or are working towards that? Do you personally see change yourself?
I think we've all had a really great wake-up call about what we've been investing in and what we in the direction of our nation. I think we all are had to snap our head around and say, what's going on here? We need some corrective action.
Mm-hmm. Liz, this is for you. It says, would the clinic considering partnering with parole officers to help people who just left prison get the mental and physical health needs that they have and have those needs met?
Yes, we would.
Oh, I love, she didn't hesitate. She's like, yes.
Yeah, but one thing the clinic does is we say yes. So yes, we would.
Well, you said you would consider partnering, but let's take it one step further. What would it take to make that happen? So it moves out of the consideration phase to, yes, we will do that.
So a while back, I met with Marcia Temple, who helps people getting out of prison through her program, and Susan knows it as well. And we were talking about how to do a reentry program. And that was right around the time I was starting to, about a year before I met Susan. And so our job is to both support the reentry programs that are out there that are working well. So in Susan's case, we're open to all of your clients, Susan, for all of our services.
Right.
And I know that geographically, we're not the best situated for that. So we're also open to making sure we identify other partners, other community health centers like us to be there to help. Mm-hmm. But in the case of someone coming out of prison, as you see, what's often needed first is housing. Many people come out of prison and end up just on the street. And then our street medicine team meets them. So we have to figure out how, what are the circumstances people are coming out. And also, I need to learn more about the parole officers training. How do they help that person not go back to prison, but achieve some new goals in their life?
Yeah. I was wondering, how do you help your clients who come there advocate for themselves, so they don't come out, and good question for you too, Susan, that they don't come out and just rely on, well, I need the Venice Family Clinic to help me permanently. How you make sure that you get this and you can move on and be self-sufficient. And the same for you, Susan. Go ahead.
I'd say Susan's an expert in this, so let me direct that to you, Susan.
Okay.
So we have courses that we run in leadership development. We support people to understand and navigate systems. So what I learned in when I was in Santa Monica was this social modeling. That's why I talk about the shared safety aspect, sharing in our community, safety, health, and well-being. And we teach about sharing in resources, each one teach one. Those that come before lead the way for those that come behind. While we're staffed at A New Way of Life, many of the exchanges between the residents is teaching each one what they learned in front of the next one that comes in. So we have a leadership development around family reunification. We have staff to reunite the women with their children. We have a course we call Women Organizing for Justice and Opportunity. And so we teach community organizing, we teach advocacy, we go to the state capitol, we go to the board of supervisors, we talk to our city councilmen. So we engage, and it's on a daily basis. COVID has stopped much of our Sacramento trips, the board of supervisors meetings and what have you, but we teach that the policies being made is what directly affects what happens in our communities. So, and I love it. I absolutely love it.
I can tell you love it, Ms. Burton. I can tell. Liz, have you seen an increase in people seeking your services because of COVID, or are people not even able to get to the Venice Family Clinic now?
So what we're doing is we shifted now. We were at almost 80% telehealth, and now we've shifted so that about 46% of people are coming in person again. And we're seeing, especially in health insurance enrollment, many people shifting into Medi-Cal that were either employed or had Covered California, which is for people who are employed, but their employer doesn't offer insurance. And so that uptick means there'll be more people. The good news around telehealth is that we don't need to build more exam rooms to see more people.
Yeah.
But we do need to then find more providers to help us as we continue to grow.
Yeah, this leads me, Liz, to a question about insurance that Navina sent. How do people who have been recently released and do not have access to insurance fare during this pandemic?
It's very difficult. And the most important thing for someone coming out of jail is to be able to get signed up for health insurance as fast as possible. Susan's very good at that in her programs. We have extraordinary health insurance enrollment people, and people can sign up through our health insurance enrollment staff, and they don't have to choose us. There's a range of choices you have of what provider you want, and we'd love for people to choose us, but they don't have to. Sometimes people live too far away.
But if they don't choose you, are you penalized if they don't choose you?
No, we're not. What I would say is there's so many people that need care.
But you know what? I ask that whenever I call and the people say on the phone, if you take this survey, press 1 if you want to take the survey, press 2 if you don't want to take the survey. I'm convinced that if you don't take the survey, that they leave you on hold a little bit longer, they take their time. That's why I ask, just are people penalized if they don't choose you?
Because our insurance workers sometimes they'll look at where someone lives and they'll say, we think it's great that you want to come to us, but that's 3 bus rides, and it's good to have your primary care within walking distance of your house or within 1 bus ride of your house. So let's talk through it a little more. Yeah,
that's good to know. Here's another question. I would like to know, how do you plan to integrate providing assistance to the children of incarcerated parents to help the family heal? How do we help the children?
So we have social workers and therapists at A New Way of Life to help with family counseling and some support and helps for the children. I'm going to use Tony for an example.
Tony, your favorite daughter?
Yeah, my favorite daughter, the one and only Antoinette Carter. And she did chat me and say she is 54. Hi, Tony. And what I found is that the children of incarcerated parents need to have a platform that their voice can be heard also, that there's space for them to talk about what experience, what they experience as the result of their parent being incarcerated. And I have found that to be most helpful and therapeutic for Tony. I hope you don't mind me saying that, Tony. She's bossy like her mom. So she's gonna give me a talk after this. And you know what? And I'll just listen.
Yes.
And then I would add, at Venice Family Clinic, we have a program called Children First Early Head Start, and it's for families with children aged 0 to 3 who often have extraordinary obstacles and needs. And we find that our home visitation program is really helpful in terms of families being able to understand their children and their development, but also get the help they need to do the things they want to do and to set their goals and to see maybe a different way forward than they might have imagined. And so one of the questions I'll have to get back to, because it's actually not a statistic we keep there, is how many families do we see who have someone who was imprisoned or is currently imprisoned? Because we see a high number of children with disabilities in that program and a high number of people who are unhoused. But I think that's a new question I need to get back and ask our Children First family.
Liz, before you go, how do you inform, a question for you, policymakers that your programs are pertinent so that the criminal justice system is not used as an answer to individuals facing trauma and mental health issues?
We do that in a variety of ways, but one way is actually through visiting some of the policymakers and bringing our clients with us. And Susan does a great job of that as well. And when they see the results right in front of them of someone who has been part of our programs, the leadership training through the Children First Early Head Start program is extraordinary. And so when those folks go to Washington, and I did a trip with Carolina and Brian, who were in the program. Now Carolina's on our board of directors. And I've never ever before did a legislative visits with an 18-month-old. So they brought their 18-month-old. And Derek, who was 18 months, stole the show. Literally, they got what Early Head Start was doing by looking at Derek and by looking at the splendid parenting that these two were doing as we were making these visits. And the program then spoke for itself. And so that's how you get that message across, one of the best ways.
I'm all for splendid parenting. I love this question, and I think it's asked by a man. How much of the work being done by the Venice Family Clinic and A New Way of Life is because of women being in leadership?
Oh,
that's a very smart man who asked that question, I bet. No, I don't know, but it's not lost on the audience clearly that you two are in these high-powered positions and that you're both women. But certainly there are men out there who are doing very good work as well.
Well, Gayle, what I can say is we get it done. Yeah, I believe in getting it done to stop the trauma, the pain and the suffering.
Do you guys, do you, either one of you think trauma can be prevented in the first place?
Yes.
You do?
Yeah.
Yes.
Both of you said yes at the same time.
Yeah.
How?
Go ahead, Susan.
With the amount of resources and supports for communities, I think it can be interrupted and it can be stopped. So I think, Liz, you have a more like clinical thought about that, but I'm sure that trauma can be stopped.
Mm-hmm. Liz?
What I would add is that, and it goes back to, there can be a cycle of trauma, like every family knows what it knows, and that becomes normal. So what I like about like programs like Children First is that it gives everybody a starting place. We're starting with your new baby, and then a conversation about what are your goals, parents?
Yeah.
What are your aspirations? What would you like your family to look like? Yeah. What are the things you treasure from your parents? What are the things you don't want to see happen? And as you begin, and this is every week, there's these conversations and play and thoughtful approaches to the children.
Yeah.
And the result is really magnificent, because in our early Head Start program, there's an elementary school behind one of our clinics. And literally every other year, a graduate of our early Head Start program is the head of their PTA, their Parent Student Association. And that speaks to the leadership, because one plank in the program is, we want to teach you leadership skills, and you can't just have leadership skills without practicing them. So we want you to also go out in your community and pick something to do.
Yeah, I'd like to think every parent has a dream for their child. I remember Oprah did a piece for 60 Minutes a couple years ago, working with trauma in Chicago. And the expert said something I've never forgotten. They said, you know, whenever you see somebody who appears to be acting crazy or is disruptive, instead of saying, what's wrong with you? The better question is, what happened to you?
What happened?
Yes.
Isn't that good, Susan? I love that.
Yeah.
Don't ask what's
Yes.
wrong with you, because what's wrong with you is very accusatory, very
Yes.
judgy. But
Yeah.
instead of saying what's wrong with you,
Yeah.
say what happened to you. And I've never, ever forgotten that. And Susan, I think you're a really good example of that. You're
Yes.
asking for help. And if someone had just helped you when you were asking for mental health services. So I know we have to wrap it up, but this is a great question, Susan, for you. Should there be a Susan Burton story on the big screen or on television? I wonder if Tony
I'm
sent
going
this.
to hold this up too.
I'll hold this up. Becoming Ms. Burton.
Yeah. So
Has her own book. Wait, you didn't hear the question yet. It says,
oh,
which actress would you like to play you in the role of the movie?
oh my
Wait,
goodness.
before you answer, hold up the book again, Liz. Hold up the book again. That's Susan's memoir. I love the title, Becoming Ms. Burton.
Becoming Miss Burton. I don't know. So Gayle, do you do acting?
No, I don't.
You don't do acting?
No, I don't. Listen,
I don't know that. And I don't know
listen,
that
I'm here in quarantine. I had to do my own hair and makeup and try to look presentable. So no, I definitely don't do acting. I have none of those kind of skills.
Yeah. I thought about it. I
actors?
thought about that, but I don't know.
Okay, well, you have some time to mull it over. You have some time to mull it over.
All right.
Thank you very much. Thank you very much, you guys, for our conversation this afternoon. I thank you so much for asking me to participate. It was really an honor to meet you both. And please know I'm cheering you on always, always in the work that you do. Thank you.
It was great. Thank you, Gayle.